Okay, bismillah, so carrying on. Keratinocytes are also found in the stratum basale. And melanin is mostly in the basal keratinocytes. So keratinocytes are found in the stratum basale. Melanin is mostly in the basal keratinocytes. And we'll see here in a picture. Melanin is mostly in the basal keratinocytes. There we are. And you see how it's above the DNA. It says here, basal keratinocytes arrange melanin in the cap distal to the nucleus, sunny side protecting stem cell DNA. Cool. Now carry on onto tanning. Let's get this focused. Okay. A person tans when melanocytes increase activity by making and transporting more melanin. When melanocytes increase activity by making and transporting more melanin. Where they're transporting the melanin to, transporting it to the keratinocytes. The signal to produce more melanin is by DNA damage of melanocyte to via UV. So signal to produce more melanin is via DNA damage of melanocytes via UV. This gives some more protection against UV. So the increase in melanin will provide more protection against UV. Additional protection is provided by the thickening skin in response to UV. Cool. And that thickening skin is called hyperkeratosis. Hyperkeratosis, as we saw in the last lecture. Carrying on to the protection against microorganisms. So Langerhans cells and the rest of the immune system are responsible for protecting our skin against microbes. So they're small pale cells in the non-basal layer of the skin. They're dendritic cells having branches from the cytoplasm. So they have branching cytoplasmic processes. Or they have branches from their cytoplasm, as you can see. Anyway, their function is an antigen-presenting cell. They work as antigen-presenting cells, working as part of the immune system. Carrying on, there are many abnormal effects of the environment on the skin. The first one we'll go into is lichenification. Now I'm going to show you a quick picture of what lichenification is. Here you can see the butters. Lichenification. It's a more extreme form of hyperkeratosis. So the hyperkeratosis is what's on my feet. Lichenification is the more extreme form of hyperkeratosis. Often the skin's reaction to excess rubbing or scratching. So lichenification is often the skin's reaction to excess rubbing or scratching. Furthermore, it can also be caused by various skin conditions such as eczema. So lichenification, more extreme form of hyperkeratosis. It's often the skin's reaction to excess rubbing or scratching and can be caused by various skin conditions such as eczema. Moving on, damage by UV light. Damage by UV can have a short or long effect. There are three types of UV: UVA, UVB, UVC. UVA and UVB, they penetrate the ozone layer, whereas UVC is blocked by the ozone. We can see that in a nice picture here. UVA, UVB penetrate the ozone. UVC is blocked by the ozone. Cool. UVA and UVB can penetrate the ozone and damage skin. And just an important fact that says here, UVA is the longest UV wavelength. The longest UV wavelength is UVA. Carrying on, sunburn. And I have a bad experience of sunburn. Sunburn is a radiation burn. It's seen as blisters, radiation, and cell death. Sunburn is also a radiation burn. It's seen as blisters, radiation, and cell death. So it's seen as blisters, radiation, and cell death due to severe DNA damage. Having ever been burnt in your life will increase the risk of cancer. Furthermore, we move on to polymorphic polymorphic light eruption. I'm going to take a look at the pic again. It's one type of several sun allergies. So polymorphic light eruption. Here's just some examples of sunburn. And here is polymorphic light eruption. It's one of several types of sun allergies. Moving on, we also have something called solar elastosis. This is a loss of elasticity, making the skin wrinkly. As you can see here in the picture, solar elastosis. The skin becomes wrinkly as there is a loss of elasticity. Furthermore, we move on to something called nevi, also known as moles. So these nevi or moles, they're benign proliferations of melanocytes. Many or large nevi increase the risk factor for melanoma skin cancer. And we'll come on to more about skin cancers just further down. We'll move on to freckles. The medical term for freckles is ephelides. They involve a genetic component and are linked to red hair or fair hair. They appear in sun-exposed areas. So freckles appear, or ephelides appear in sun-exposed areas. Move on to solar lentigos. Solar lentigos, aka liver or age spots. They are age-related and they're often on the back of the hand. They result from exposure to UV, which will cause proliferation of melanocytes and accumulation of melanin within the skin cells, or aka keratinocytes. And there you can see solar lentigos on this picture. Moving on, we also have something called solar keratosis. This is abnormal growth of keratinocytes, and it's common in bald people. So here we are, solar keratosis, dysplastic growth of keratinocytes or abnormal growth of keratinocytes, and it occurs in bald people. It occurs in bald people. And furthermore, we have skin cancer. So skin cancer can be split into melanoma and non-melanoma. Skin cancer can be split into melanoma and non-melanoma. The non-melanoma can then be further split into squamous cell carcinoma or basal cell carcinoma. Melanoma can be thin but dangerous as they spread rapidly. So skin cancer can be split into melanoma and non-melanoma. These non-melanoma can be split into squamous cell carcinoma and basal cell carcinoma. Now melanocytes are dangerous. Not melanocytes, the melanoma. These melanomas are dangerous. Why are they dangerous? Because they appear thin, but they're dangerous as they spread rapidly. Moving on to burns. There are different types of burns, and I'm going to show you in this picture. Different types of burns. And also, if we just go back onto melanoma, why it's dangerous, as we said, it's thin, but it can it's dangerous because it can spread rapidly, and this is just an example. Wow, how fast it can spread. Now we'll move on to burns. So, as I was saying, there are different types of burns. Partial thickness is a superficial burn of the epidermis, where the epidermis is destroyed. Partial thickness. So there's two types of partial thickness. Firstly, the one type is superficial burns, where the epidermis is destroyed. Can also be classed as first degree. And the second type of partial thickness is where it's slightly deeper, affecting the dermis and the second layer. And we can see the two types of partial thickness here. One's superficial burn, where it only affects and only destroys the epidermis, whereas the second one destroying part of the dermis. Nevertheless, there is something also called a full thickness burn. This destroys the epidermis, dermis, and the subcutis. These burns will scar, and there will be loss of pain prick sensation when the patient appears in the hospital. So here you can see the full thickness burn. As we said, there's a loss of pinprick sensation when the patient presents acutely, or when the patient presents to the hospital. Move on to irritant contact dermatitis. This occurs when there's too much exposure of a substance. You can still use the substance, but you need to reduce the amount. People vary in sensitivity. For example, is soap, in my case. Symptoms could be redness, itching, swelling, blistering, or scaling. And we'll take a look at a picture. Just bear with me. There are many types of irritants, such as white spirit, bleach, washing powders, polishes, soaps. So we'll have a look at the picture now. There we are. That is irritant contact dermatitis, as you can see. Furthermore, we move on to allergic contact dermatitis. This is an allergy to something that contacts the skin, but there is an immune response that is involved. That's the difference between allergic contact dermatitis and an irritant contact dermatitis. Here, in allergic contact dermatitis, the immune system gets involved. There's only a tiny amount, and only a tiny amount may be sufficient for a reaction. Allergy may develop after long or short use. There may be redness, itching, swelling, blistering, or weeping. Allergens may be metals, such as jewellery, leather, or latex. So we have a look at allergic contact dermatitis, and there, as you can see, on her ear and on her neck. And the important thing about allergic contact dermatitis is that the immune system is involved. Okay, we go into an important point here. The irritant contact dermatitis is common, whereas allergic contact dermatitis is uncommon. Allergic contact dermatitis has stages. First, there's two stages.